And another reason this conversation matters, another reason this conversation matters is because the lines between therapy and coaching have become incredibly blurred online. A lot of language being used in the coaching space right now that's actually therapeutic. Words like healing, processing, uh, trauma, deep work, inner child, what else? Attachment, nervous system regulation, accountability, uh, transformation. The list goes on and on and on and on and on. And these are not just trendy buzzwords, right? Many of these concepts come directly from psychological theory, clinical training, trauma research, that kind of stuff, therapeutic practice. And what I think is that the public is becoming just increasingly confused, just increasingly confused about the difference between coaching, therapy, consulting, motivational speaking, and clinical mental health treatment. Like, everybody's just confused. Everybody's confused. Okay. And that distinction matters because licensed mental health professionals are trained not only in how to support people, but in how to assess risk, recognize pathology, understand trauma responses, maintain ethical boundaries, develop treatment plans, um, identify when someone needs a higher level of care, intervene responsibly. We're trained like we're trained in scope of practice too. And honestly, one of the most dangerous things happening online right now is people practicing adjacent to therapy while distancing themselves from the accountability. Um, yeah, it just boggles my mind. Because if you are guiding people through trauma processing, emotional healing, attachment wounds, severe relational distress, or psychological suffering, you're entering clinically sensitive territory, whether you use the word therapy or not. And consumers deserve the clarity. They deserve clarity, not confusion. So, again, this is not about attacking coaching. I offer coaching services. This is not about attacking coaching. Coaching has a place, right? But coaching and psychotherapy are not interchangeable. And there are appropriate persons, appropriate criteria for coaching, and there are appropriate criteria for therapy. And I think it's irresponsible if influential figures blur those distinctions in ways that leave vulnerable people unable to tell the difference.